talking about extending some of these provisions permanently for the long term, but it seems the pandemic is going to be around for many, many months, if not years. Do you envision having to extend emergency provisions to give families more security while you continue to negotiate for long term?
Well, right now we still have, according to the rescue package, this will last for a couple of years. Hopefully we will be rid of the pandemic long before all of that. But we're there to meet the needs of the American people. We want, again, whether there ever was a pandemic or not, we had the need to lower cost, and that is what we attempt to do. Dr. Lee, Peter, did you want to speak to
that? Again, the American Rescue Plan was specific to the pandemic, and these benefits go through 2022. We've already signed up hundreds of thousands of people that have benefits right now. In California, we are open for enrollment right now. So if people are uninsured today, they can walk up to our doors, go to coveredca.com and get insurance that will be for the balance of 21, but we're already doing planning to enroll people throughout 2022. The issue before Congress, though, is 2023 and ongoing. As the speaker noted, the American Rescue Plan lowers costs in ways that need to be permanent. That irrespective of the pandemic, we have people who have families with diabetes, with cancer. Lower income Americans need more financial help. That's exactly what the American Rescue Plan models for a permanent need that Congress will have before it in the next 4 months.
Thank you for your question. Any other questions on the subject at hand?
That's a related one. Well, we talk of equitable access to health care, Speaker Pelosi. We're talking about giving boosters to the American population for COVID-19 shots, while countries around the world are still struggling for access to their broader population. Why is it important to prioritize a third shot here instead of prioritizing sharing our supply with the people?
Well, I think we have to do both. The fact is that we are learning. The data shows that those who had received booster shots, say 8 months ago or something, the protection is waning. We do have knowledge of who that could be at nursing homes, though mostly people got it earlier with those with a pre-existing disposition to be receptive to the virus, but also older people and the rest. I put myself in that category, and so we have that responsibility, but we also do have a responsibility to the rest of the world, because unless we're all protected, none of us is really protected. There are initiatives. We are sending out some vaccine. We have to strive to do more, and we cannot ignore what the rest of the world wants. No other subjects on this? Questions on this subject? No? Yes, sir.
You mentioned you were at the AIDS Memorial yesterday. Here we are as a general. It's been a passion and priority for you over the decades to put health care and compassionate care and affordable care.
Yes, well, when I first went to Congress, the first thing I said on the floor of the House, I said that I told my constituents that Sala Burton, that Sala sent me, and I'm here to fight HIV and AIDS. That was my very first words on the floor of the House. Some people were startled by that because they still were just not used to accepting that as a priority for a member of Congress. But we have been very blessed in our community, really starting here, Dr. Paul Burbidge. So many leaders in our community were on the forefront of community-based care, community-based research, community-based prevention. Community-based, I say that over and over again, listening to the community. It served as a model for the nation when we wrote the Ryan-White Care Act. Much of the intellectual resource of it came from here, and again from the standpoint of care, from this very institution, San Francisco General. So yesterday we were there talking about where we go from here on that subject, but I also had the sad privilege of placing flowers at Jim Hamel's name there, who had right from day one at the start of the AIDS epidemic used his philanthropy, his leadership to help fight against HIV. Just one thing I will say, when this more than a year ago, I called had a phone conversation with the head of the World Health Organization, and I said, tell me, how has our fight against HIV/AIDS helped in this fight on COVID? For example, something that was bipartisan with President Bush, the PEPFAR an initiative to get drugs in an affordable way into communities so that people would no longer feel stigmatized, but hopeful about if they revealed their status. And it has been important in terms of the science, in terms of the distribution of clinics, in terms of the receptivity that people will have to something new. And I salute President Bush for his ongoing interest in all of that as well. Okay? Yes, sir.
It's off topic.
Any comments you want to make about institution?
Dr. Susan Ehrlich, Chief Executive Officer here. I just want to make a comment about weaving in this idea of the Affordable Care Act and the service that we provide here on campus. We've been here for more than 150 years, providing care to the community through any number of plagues: smallpox, bubonic plague, tuberculosis, HIV/AIDS, and now COVID. And what I've seen in the past year and a half is what it is. Why is it that we've been able to do this so effectively in this place? And it's because we live in a city that is supported by the leaders, it's supported by the community, it's focused on the community, and it uses science, data, and facts to respond to the problem at hand. It's why we have the lowest death rate from COVID in the United States. We have the highest vaccination rate, one of the highest vaccination rates in the world. And our hospital has been busy, but we've done relatively well in the United States. And so I just want to express my gratitude to the speaker for being one of those leaders, and to this community for supporting us in the work we do. Thanks.
I'll just respond to the question about the booster shots and the global vaccine equity. You know, I think as Americans we have a tremendous responsibility today to really think about the rest of the world. Many of us have received first or second doses, and there are so many people in countries worldwide that are surging across Africa. India just went through its surge, Indonesia, Brazil. So I think we have a tremendous responsibility as Americans to be advocating for people all over the globe. And then at the same time, as a mom, I'm thinking about my child starting preschool in 2 weeks, and I'm wondering when my kid's going to get vaccinated. So I think I just want to recognize that these are really complicated decisions before us, and I really love how the speaker put it. It doesn't have to be a but, it can be an and we have to get ourselves out of that scarcity mindset and really figure out how we're going to expand the supply of vaccines so everybody everywhere can get vaccinated.
Thank you so much, Kriti. I just want to say that this institution, San Francisco General, has had many great leaders to, again, give us confidence, meet the needs of the people of our area. As a trauma center and the rest, everybody had to know how to get to San Francisco General, a leader not only in our city but in the West. But all of them would be very proud of the leadership of Dr. Susan Ehrlich, the CEO of the hospital now. She has just brings so much knowledge, judgment to the position that she holds, and I join her in commending our leadership in our city. Mayor London Breed has done a wonderful job. I get a daily report from my staff member, Dan Bernal, who's the chair of the San Francisco Health Commission, that the pandemic the rate is decreasing in San Francisco because of precautions that are taken. I've asked about mandates federally, but the mandates locally here, for example, have enabled us to proceed, some that will come into effect next week, proceed in a way that reduces the spread of the virus. And I salute the mayor. Also support Gavin Newsom for what he is doing. The campaign against him now is using. They want to take down any mandates for masks, take down any recommendations for vaccinations. That's their campaign. So this recall has become a matter of life and death when you see the other side opposing the initiatives put forth by the governor for reducing the pandemic in our state. You had a separate question, sir?
Yes. What do you have to say to the women in Afghanistan right now?
Yes. Well, the women of Afghanistan women and girls in Afghanistan have been a very high priority for many of us in Congress, Democrats and Republicans alike, House and Senate, White House, President Laura Bush, Michelle Obama, Jill Biden, all of us have had that as a high priority. Quite frankly, I think some of the support for our presence in Afghanistan across the country sprang from the interest of the American people of the fate of women and girls in Afghanistan. I've been in Afghanistan 9 times, many times led by Susan Davis of California for a Mother's Day visit. Well, of course, our whole purpose is security, to thank our troops, some of them moms, some of them grandmoms fighting the war, and also to remind some of the others to call home for Mother's Day, but nonetheless also to visit the women in the hinterlands, not just in Kabul, that's obvious, but doctors, professors, lawyers, judges, women that are highly visible, and the need for us to protect them, but also the poorest of the poor women throughout the country, and seeing their girls go to school, to see the next generation to have opportunity that they did not have. So we have to make this a subject of the greatest transparency, shining the biggest, brightest light on what the Taliban may do. So far, we're not, they're painting over beauty salons and things like that. We'll see where it goes from there. People ask me, do you trust them when they say, we're not going to change we're not going to hurt women and the rest? We'll see, but we can't take that chance. I've just seen that Malala, lovely Malala, who has been so courageous, is speaking out on this, and I have a call into her to say, any way we can help you, but we do want that. Now, you give me an opportunity to say that please call our office if you have a concern about Afghanis, about people getting out. What do we say? Let me give the right, because I have so many websites, but this one is, I'm sorry?
Pelosi.house.gov.
Pelosi.house.gov. Pelosi.house.gov. That's my San Francisco place for you to call. We have speakership thing, this, that, want to go there. And then we are in touch with the State Department about specific cases with NGOs there. Let me just say that I was very proud, and I spoke to my colleague Jason Crow this morning, who took the lead on the visas for those who helped us there, and largely helping in the military aspects of it. But many NGOs were helpful there, Roots for Peace, local to us here. Also, there are other groups that were helpful that were not U.S. NGOs, but NGOs there that need that relief, that visa relief coming out. My most recent communication from DOD this morning was that they've identified a large number of Americans, we're just talking Americans right now, who have visas and need to get out. Well, they're Americans, they don't need a visa. But the question is how to get them to the airport, and that's a question of the intentions of the Taliban as well. So this is all-consuming in every way. San Francisco is a very welcoming place, has always been there. When we had the Muslim ban, remember that, over 4 years ago? Well, that was a direct hit on the people who helped us. And therefore, the diplomats and military and all came forward and said, we have to get rid of the Muslim ban, because that hits the people who helped us so much in Iraq and Afghanistan. And at that time, I just always like to say this because I think it's important. At that hearing that we had, of course it was a rump hearing because we didn't have the majority, but we had it anyway. At that hearing, the leader of the American evangelicals, the evangelical community, came to oppose that Muslim ban, and he said this. He said the U.S. refugee resettlement program is the crown jewel of American humanitarianism. We just have to remember that and be more welcoming, especially to those who helped us, but nonetheless for those who have a well-founded fear of persecution wherever it may be. So again, it's about values. It's about values of our responsibility to other people, as other countries, other people affected by all this. That's why I was asking about HIV/AIDS. Could we use that mechanism to be able to get more drugs to more people to fight the pandemic in the southern hemisphere specifically? Is that it?
Last question, anyone?
Yes, sir.
Yes, I'm one of your constituents. I just wanted to say I appreciate you being here and to help lower the cost of drugs, but we don't want insurance. We want free health care, Medicare for all. And you can do that. You can pressure Joe Biden to give us Medicare for all, every citizen covered. No more insurance.
Well, let me just say, with all the respect in the world for you, my constituent, my boss, I always say my constituents are my bosses, that I owe you candor. And I believe in health care for all Americans. I believe the route that we are in expanding, please I listen to you, expanding the Affordable Care Act. Now, we do have in our reconciliation package that we're hoping to pay for with the prescription drug money, but nonetheless we have in our expanding of Medicare benefits, hearing, visual, and dental, so that is a better benefit. But frankly, the Affordable Care Act benefit is a better benefit. And that we share one view, and that is we want health care for all Americans. Thank you all very much. Thank you.